Welcome to the TCCI Business Briefing Webinar for Prevention of Musculoskeletal Related Injuries. I will now hand over to guest speaker, Scott Willis.
No worries. Thank you very much, Lauren, and thank you very much for asking me to attend this session and talk to everyone about just prevention of musculoskeletal injuries and how we can go about reducing some of the risks. Of course, we can't stop all injuries because of just the nature of how they occur, but I think we can definitely prevent some of them and reduce the risk to not only the workers but also the employer and the organisation that they work for. First up, I just want to acknowledge the traditional owners of the land in which we meet today and pay my respects to elders past, present and emerging. I'm coming from the land of the Palawa people on the northwest coast of Tasmania. I'd also like to acknowledge any other Aboriginal or Torres Strait Islander people with us today. So just a little bit about myself. My name's Scott Willis. I'm a physiotherapist and a co-director of coastal physiotherapy on the northwest coast of Tasmania. I'm currently also the national president of the APA, or the Australian Physiotherapy Association. And that takes me around the country, but also international as well, and really highlighting where physiotherapy can make a difference and value add not only to the health system, but also to industry and organisations that are present today. I've also got a really special interest in occupational injuries and health and safety, and it all came about by treating patients in the clinic and trying to understand why they're injuring themselves and how we can actually prevent them from happening instead of waiting for them to come and see me in the clinic. And I was quite fortunate enough to work in some big organisations such as Australian Paper, where it really got me thinking and started in occupational health and looking at some of the processes that are around in organisations, and also some of the processes that employees have to go through to formalise their employment with an organisation. So hopefully that gives me a good understanding across a broad spectrum of occupational health and safety. So what I tend to do a lot of is do a lot of task analysis and risk assessments and analysis. And I'll go through a bit of that later on. Also do quite a bit of manual handling training and quite different in regards to very task specific, rather than just do death by PowerPoint. I always say that if you're going to do some type of manual handling training, it's got to be task specific and specific to what you're wanting to get across in the industry that you're intending to educate. Same with pre-employment assessments, and I'll go through this later in the talk. And just looking at with a pre-employment assessment is you've got to actually assess what you want to, what the employee is going to do within their work duties. There's no use just doing a standard musculoskeletal screen when you're not actually testing for the tasks that they have to actually do, or some of the tasks that they have to do within the organisation. So I'll go through a bit of that as well and give you a bit of case studies on that. Same with ergonomic assessments. We do a significant amount of ergonomic assessments, and especially now with the new standing desks, and I'll go through some of the principles behind that as well. And then we also perform quite a few preventative strategies, and you might have heard of pause exercises or warm up and cool down. So some of the different strategies that we can implement on there as well. And then there's also on-site services. So we provide quite a few different on-site services in industry, so that your employees don't have to come and visit, say, myself or one of my colleagues in the clinic, so that there's no lost time from the travel between work and seeking some type of assistance. What I'm going to cover today is who I am and what's coastal physio, but also the state of play of where some of the statistics are showing where we need to do some more work, or what the statistics are showing us and saying in terms of some of the decreases, but also some of the increases in some of the areas of injuries. What we can also do to reduce some of these injuries. So there's some quite tangible examples that I'll try and give you, so that you can implement them if you want to, It also just start getting you thinking about what are some of the things you can do within your own organisation or some of your work practices to try and reduce some of these injuries. I'll also just go through some risk assessments, some of the different task analysis, different manual handling techniques, and I'll also just touch briefly at the end on some of the COVID related issues and how we can relate COVID to some of the musculoskeletal injuries that we're seeing as well. I'll also just take you through some of the different pause exercises and what we tend to try and get people to do and why, and then look at what some of the good ergonomics really look like, not just at sitting but also standing as well. And I'll give you a bit of a case study and an opportunity to ask any questions at the end. So if you do have any questions, we'll have some time at the end for you to ask me any specific things you want to know from the presentation. So who are Coastal Physiotherapy? So we've got quite a few physiotherapists and exercise physiologists that operate from our Burnie and Somerset clinics. And we go across the whole northwest coast, down the west coast onto King Island. So we have quite a broad area that we actually provide services to. As I said, we're at Somerset and Burnie. We look at workplace injuries and workplace visits, but we also treat any type of sports injuries, any type of paediatrics, chronic disease management, and we've also got an offshoot of a chronic pain clinic that one of our exercise physiologists works with a psychologist called Pain Solutions, and they do quite a bit of work in chronic pain management for the northwest coast, which is quite an amazing service considering the small population that we have here on the northwest coast, but also Tasmania wide as well. We also do quite a bit of preventative work, not just with industry, but also sporting clubs, and also for the general population as well. We also provide some consultative work to the Aboriginal Health Services here in Burnie as well as Smithton. So I thought it's quite an interesting time to do this talk because August is National Tradies Health Month. And the Australian Physiotherapy Association has been doing this for over 10 years now, and really just highlighting what physiotherapists can do to assist in some of the tradies injuries, but also some of the mental health aspects as well. We try and not to separate that physical and mental health, and that's one of the main things that we're trying to get through today or this month in 2022. Coming off the back of COVID related issues, that we need to look at not just the physical side, but also the mental health side of things as well. So if we have a look at why it's important for tradies, especially this month, of why we want to try and get some information towards tradies, but also organisations that employ and also have contractors coming onto site. We always see that about 60% of tradies aches or pains are due to their employment. So it's quite a significant issue for any type of tradie when they're out in the field. And also tradies account for about 60% of all musculoskeletal injuries across all professions Australia-wide. So again, you can see it's quite a significant issue for our workforce in Australia. And if you look at all medical conditions across all professions, tradies account for about 39% of all those medical conditions, such as diabetes, heart disease, obesity, and those types of things. So again, we want to really highlight and assist all our tradies because they're the workhorse of our country. About 5.4 weeks of lost time injury is the average for serious workplace injuries. And this can really affect not just, like I said, their physical health, but also their mental health. And on the back of COVID, we're just seeing that there's been a bit of an increase in those mental health issues, not just in tradies, but in the general public as well. And all these types of medical histories, but also the musculoskeletal injuries, can really lead to some of these chronic conditions that we see, such as low back pain, neck pain, shoulder tendonitis or tendinosis. We can see some hamstring issues from the amount of bending over that some of the tradies have got to do, or knee injuries from crawling in cavities and things like that I see every day. And 40% of poor mental health is impacted on relationships. And I think we all understand that if relationships are not going too well at home, then that really affects their work within the organisation as well. So it's quite important to keep an eye on that as well. And 2/3 of tradies, when we research them, say that they will do the exercises if the employers prioritise it within their risk matrix, but also as part of their employment with the organisation as well. So you can see it's quite a significant issue for tradies. And what can we do for to tradies to try and reduce the risk of injuries? And we always talk about warming up each morning before you start. You know, when you look at sports, I always come back to the professional sports of, say, AFL football, NRL soccer, hockey at that higher level. If you've just come off the back of the Commonwealth Games, and if you have a look at them, you know, you tend to get them warming up and stretching quite frequently during the day, not just before work, but they do it constantly during the work as well. So warming up is a part of it, but you also got to try and go through the whole day of doing some type of stretching or warm up with regular breaks. We also talk about pacing your workload and work and your rate throughout the day to really avoid issues related to overuse and fatigue. So it's not just, you know, work, but also trying to work out throughout the day how you can incorporate some of these lower fatigue or overuse issues that you might see. Also, communicating well with your workmates. I think it's quite common sense if we've got good communication skills from management, but also within workmates, you tend to see a reduction in workplace injuries. I think we also need to have a culture within an organisation, but also within the individuals that are working within your organisation to speak up if they feel a bit uneasy about the level of risk that they're exposed to at work. And I think this is improving with our communication skills and educating workers that you know, that they can speak up and there won't be any repercussions from those. And we try not to put ourselves at risk of injury by rushing, trying to get to a deadline, and trying to really start planning a little bit more so that you've got an even spread throughout the day, but also the week, month, and year. And really willing to say no when required to ensure both your health and safety, but of the others as well, not just within the workplace, but also maybe if you're within a public thoroughfare, as well as looking after the public aspect of it as well. And really seeking advice from your physiotherapist or any other healthcare professional if there's pains and aches that are still persisting, so it doesn't get to the point of that chronic pain type of area. And trying to manage injuries immediately, so rather than just waiting, so, you know, putting some ice on it, compressing, elevating if you do have some type of workplace injury. So they're just some of the very, very basic things I think we can do for tradies, but also tradies can do for themselves as well. So if you have a look at the statistics around what are the serious claims statistics over, and this is the latest that I could find in 2018 and 2019. And I think one of the biggest thing is that median time lost of 6 weeks per serious claim, and then the compensation paid of nearly around $12,000. So I think if you can really try and look at that and think about the impact that could have on a business, but also on premiums moving forwards for the bottom line. And it's quite a significant amount of serious claims around Australia, nearly 115,000 of them. So if you have a look at, but over the last say 20 odd years, we have seen quite a significant decrease in serious claims and injury frequency rates by about 26%. And I think that's on the back of the work that the TCCI, but also WorkSafe are doing. And I think the prevalence of people like myself, physiotherapists or occupational health physicians that are really implementing some sound strategies to reduce the workplace injuries that we saw probably 20 years ago. So if you have a look at some of the serious claims by gender, you can see that you know, females are probably going to have a little bit more time off work, about 6.2 weeks compared to the males of 6. The males, though, will cost a little bit more, and the frequency rate of 6.2 compared to the 5.1 for females. So you can see there is a little bit of difference, but I don't think it's a significant amount of difference there. If you have a look at who actually gets injured, so the serious claims by age group, I think you know, the younger type of workers around that 30 to 34 years had the lowest claims, so around that 4.5 claims per million hours worked. Where if you have a look at the older work cohort like myself, in the not quite in the 60 to 64, but getting there, that we see that as about the 8.2 claims per million of hours worked. The state of play from WorkSafe Australia, some of the main causes that we see of the serious claims by the mechanisms of the incidents in 2019, 2020, was about 37% of those were a body stressing. So it could have been the position that they were in, or the vibration, or the holding and things like that. So it's quite a high proportion of that body stressing. And then you look at about 23% where you had the falls, trips and slips. And again, these are quite a lot that we can prevent from happening. And then the 16% by being hit by moving objects. And you know, we're seeing quite a bit of work being done on trying to isolate and eliminate some of those aspects of them. And hopefully I can give you a few more suggestions as we go through. So some of the serious claims by nature of injury and disease, if you look at probably about 39% as some type of traumatic joint or ligament and muscle or tendon injuries. So that might be lifting, it might be pushing or pulling, and it might be someone that's had a fall or twisted their ankle, their knee, or reached up and or irritated you know, their shoulder or their neck. They're the types of the major things that will cause the serious nature of the injury or the disease. Wounds and lacerations, and hopefully not too many amputations or internal organ damage, but we see about a 16% for that, and the 16% for musculoskeletal and connective tissue disease as well. So that's some of the, you know, constant loading, some of the positioning, and some of those aches and pains that will lead on to some of the chronic musculoskeletal and connective tissue diseases such as osteoarthritis or muscle strains that we see. And some of the areas that you would see that would be the areas that we notice mostly, and this is quite reflective of what I see in the clinic as well. If you ask me, you know, what I would see majority of, I think you'll be you know, looking at backs, necks, knees, shoulders and arms. I think they're probably the major areas, and I think this is quite reflective of what we see in the statistics as well, especially the, you know, low backs, necks, arms and knee areas is what I see probably majority of my time as a clinician in the physiotherapy clinic. So what are some of the occupations with the highest frequency rates? And I know on the call today we've got quite a broad spectrum of people that are attending, so I thought I'd try and break down some of the different industries and see where the statistics are telling us. So I think some of the occupations, it's not really surprising that the labourers have quite a high percentage of serious claims per million hours worked, about 8.1. And one thing that was really surprising to me, but probably not when I really look at it, because I see a lot of these people in the clinic, is community and personal service workers. So your nurses, your you know, carers in aged care facilities, but also out in the community as well, that really look after people. They've got quite a significant serious claims per million hours worked as well. And then the others, such as machine operators and drivers as well. If you have a look at some of the industries with the highest frequency rates of serious claims in 2019, 2020, I think this is quite a reflective of what we're seeing here in Tasmania as well, where agriculture, forestry and fishing is quite significant, and it's increasing in Tassie. Same with manufacturing. We had probably a bit of a hiatus a few years ago, but I think we're seeing that manufacturing is starting to get some or ramp up a little bit as well. And then your transport, postal, and warehousing, especially now with all the online shopping and with COVID and things like that, I can see that that's going to be a huge area for Tasmania coming into the next 5 to 10 years. So if you have a look at the proportion of claims, of serious claims involving the body stressing by jurisdiction, and you can see I've just highlighted here Tasmania. So that red line that's going straight across there is pretty much the average of all jurisdictions, and you can see Tasmania is still above that line, although if you have a look, we are starting to reduce over the 2019, 2020, and I'm hoping that that will continue with some of the work that we're all doing and seeing within the organisations and workplaces. If you have a look at here, and this is the frequency of injuries of all the different industries, and if you have a look at the axis down the bottom, if you have a look at some of the areas where we're seeing the claims per million hours worked, some of these are quite large or starting to increase here in Tasmania. So agricultural, forestry, and fishing, like I said. We've also got manufacturing. We've also got transport, postal, and warehousing. And then if you look at Q, which is the healthcare and social assistance, and I'm seeing a huge increase in probably presentations that I'm seeing in that area, because we're an ageing population in Tasmania, and probably seeing a lot more, say, NDIS, caring into the community, aged care facilities, hospitals that we're seeing more bariatric patients coming through as well. So we're seeing a lot more risk and injuries for those types of populations and workplaces as well. And then we're seeing construction, which is E. Again, we're seeing quite a boom of construction over the last probably decade here in Tasmania. And then probably the arts and recreational services as well. So you can see it's quite reflective of Tasmania, and an increase in some of the organisations, but the industries that we're seeing from increases here in Tasmania. Then if I break down, so what I've done here is just really breaking down some of the frequency rates in some of the areas so that we can see what they are. So this is the agricultural, forestry and fishing by jurisdiction. So you can see I've highlighted again Tasmania just sitting above the line, holding quite well, but probably the year prior, what's that, 18-19, was a little bit of a hiatus there, but you can see it's quite stable there. But if you look at Northern Territory, it's quite a significant contribution that they had some years ago, but you can see the significant reduction that they've had over the last 3 to 4 years. And then if you just have a look at this next one, again, you can see Tassie down here. We've just had a bit of a hiatus there as well on those last 2 years. So I just can't quite see what the top part of it is because of the screen's been taken up with the top part of the screen sharing. But you can see Tasmania there in the last couple of years is still having quite a significant amount of injuries per million hours worked there. If you have a look at manufacturing, again, here's Tasmania, had quite a bit of a significant over the last 2 years, have an increase in jurisdictional reporting of claims over the last 2019, 20 and 18 and 19. And I think that's probably a bit of an increase in manufacturing that we saw here in Tasmania as well. Then if you have a look at construction, I think this is quite a bit of an issue. I think we're increasing construction and big stuff here in Tasmania in terms of construction, but you can see the injury rate is increasing significantly as well. If anything, it's leading the nation in the serious claims per million hours worked. With hopefully I can give you some suggestions where we can maybe reduce the risk of these types of injuries moving forwards. And here we can see again the Tasmanian part of it is increasing a significant amount again, which is quite a bit of a concern for Tasmania compared to the rest of Australia. And you can see there is a bit of an upward trend in that area as well. Retail, same type of thing. Tassie again is quite a significant increase compared to the rest of Australia, but also over the last 2 years of this reporting period. Retail trade has seen a significant increase in serious claims per million hours worked. And then again, Tassie again has seen another significant increase in frequency rates of serious claims for transport, postal and warehousing compared to the rest of Australia. And again, I highlight those last two years that have really had a bit of a spike. So, you know, looking at that 2019, 20 and 18 and 19. And then even administrative and support services, again, Tassie is above the line, but you can see there for the last reporting period of 2019, 2020, we've seen a bit of a reduction in those areas. And then public administration and safety. You know, you'd think that we would probably be a little bit below the line here in Tasmania, but you can see it's been quite stable for some time, and there's been really not a great amount of shift in downward trend in claims per million hours worked for serious claims for this public administration and safety. So again, hopefully we can give you some type of indication of where we could probably reduce some of the risk there for you. And this is a big concern for me working in healthcare, but it's not a surprise to me because of the amount of work that we're seeing here in Tasmania. And I think it would be very interesting to see the next couple of years during COVID and then post-COVID because of the serious claims that we'll be seeing with COVID as well. But again, you can see Tassie is quite a significant amount higher than the rest of the nation, and you know, I think that's a significant risk for healthcare and social assistance moving forward, where we would have to attempt to attract more and more of these workers because of the claims that are starting to happen, and we need to look at reducing them. If we look at the return to work claim, I think we see that we're pretty much on par to New Zealand, our closest neighbour. About 82% of our injured workers actually return to work, which is quite pleasing. But hopefully, again, we can get the workers back to work a little bit, or the percentage of it a little bit better than that. This is the average payroll across all the workers' compensation costs that organisations and industries will have to fork out. And again, you can see in some of these high-risk areas here in Tasmania, we're seeing that they're the highest premiums as well. So if you look at agriculture, forestry and fishing, we're still seeing you know, the percentage of payroll is still a significant part of the expenses for that industry. And then you look at transport, postal and warehousing, and again, Tasmania is starting to increase in that area, but our injury rate is as well as construction. And you know, we saw the stats before where the construction has actually increased significantly compared to the rest of Australia as well. And then it's interesting that you know, if you look at the healthcare and social assistance, that it's still quite low compared to what we're seeing in the claims, and the serious claims, especially here in Tasmania over the last few years, quite a significant higher than what we see Australia-wide. So why do we need to be aware of the risk, and what can we do for this? What can we do to reduce our injury? You know, I think we all know about risk assessments. I'm going to just tell you a little bit about task analysis, but also specific pre-employment assessments, that manual handling, task specific, some of the pause and warm-up exercises, ergonomic assessments, but also the post-COVID safety measures that we all should be starting to think about and start implementing some of the things that you can do for your employees and yourself as an organisation. So I think if you look at, this is quite a really good, I think, diagram about risk assessment. And I think if you look at this, I take away a couple of different things. And the points that I really want to just emphasise here is that management's got to have a strong commitment to this risk assessment. It can't just be, let's roll it out and yeah, we've done it, tick a box and that's it. I think that's where it falls down in risk assessments, is that it's not followed through, or it's not perceived by the employees or some people within the organisation that management really has a strong commitment to it. And you've got to consult throughout. And I think this really highlights, if you look at the outer circle, every step in this is a consultation phase as well. And I think this is where some people or some organisations fall down, where they don't actually consult highly or broadly with the workforce. So how then can we get them engaged if we're not consulting with them? And I think we continuously need to review our control measures. And if we look at the control measures that we put into it, we need to continuously review them and implement any changes and redo if there's any changes that we do, and go through that process. So it's a constant continuum. It's not just, okay, let's do it today and we'll forget it until next year. It's a constant process that one, management needs to commit to, two, the consultation needs to be right throughout, and the control measures need to be reviewed and redo if there are changes. And if you look at the hierarchy of control, we've seen this constantly over and over, of trying to eliminate, substitute, isolate control measures, of engineering them out, administrative controls, and then your PPE. So remember that highest part is the most effective, but we still can do some significant aspects of these whole hierarchy of control, going from elimination right down to PPE. So hopefully I can give you some, again, tangible examples of what you can do within the workplace. So I'm just going to show you a bit of a case study where this really highlights, I think, where some of these aspects of risk assessments, but all these other bits and pieces that come into it. So if you look at, say, an abattoir, an employee that works there who injured their shoulder while performing duties in a boxing room. So if you think about a 30-kilogram boxes of meat, and it might not be, if you can associate this with your industry and your organisation, it might be a 30-kilo box of something else that you produce or do during your workplace or work day. So you're picking up 30-kilo boxes of meat, putting in the freezer at different levels from shin to overhead, and only 2 weeks into the injury occurred. There was no pre-employment assessment done of what the employee's capacity could be. So we didn't know exactly if this employee could actually lift 30 kilos of boxes of meat from shin to overhead, if he could do it repetitively during the day, because he's got to do it multiple times per minute, per hour of the day, every day, within a cold environment as well. He's general practitioner certified for light duties with no real lifting more than 10 kilos or repetitive shoulder actions. But it didn't improve with his rehab, so he's referred to an independent medical assessor and requested information about the roles and duties or any other alternative duties. So the role of the IME is really just to have a look and see what else can be done to assist the employee and the employer getting people back into the work, but also doing it in a safe manner. There was no task analysis, so we didn't actually know what the task actually had to be done or what they had to lift. There was no job library as well done, so we couldn't send anything to the IME or to the GP to say, well, you're saying that there was no above head work, but can they do this or that? Can they do this job? There was nothing available to the GP to actually give them some information that they required to make that decision. The independent medical assessor had no recommended parameters as well to any return to suitable duties within the factory. There was no objective measures of what these parameters fit within any of the roles within the factory, so we had no idea of what they had to lift, how many times, at what levels, if the employee could actually do that, or even lift 10 kilos to go into other areas. The GP had no idea of any operational processes within the factory. The insurance company wanted this employee back within the factory doing some type of employment, some type of work. As we all know, getting employees back to work as soon as possible is the best outcome that we can look for, because it's going to hopefully drive them to stay at work rather than being at home and be disconnected. And the employee wanted to know what they could safely do within the factory as well. So where can we help as an occupational health physician or a physiotherapist within the factory in the claim? You know, I think we could do a task analysis of the position of where the injury occurred. So actually have a look at every part of that aspect of the position, and then look at what they had to lift, how many times, at what positions, in what are some of the cold environments, and what are some of the forces that the employee had to lift, push, pull, carry, or anything like that. We have to do a task analysis of every position within the factory, and just so then we've got a bit of a library of where, if there's an injury occurred, we can send an employee to a different part of the factory and they could safely perform it and still be contributing to the operation of the organisation. We do a risk assessment of the area where the injury occurred to see then if we could eliminate, substitute, or do anything to try and process it out. We could also set up a task-specific pre-employment assessment as well to see if new employees had the capability to do the tasks that we wanted them to do. We could also do and then implement it as well and see it through. Perform a manual handling assessment as part of the pre-employment assessment to ensure that they had the actual technique to lift these heavy weights as well, and then follow up with a task-specific manual handling training within the organisation as well. And this is what a task analysis sheet looks like here, where this really has a look at what they have to do in terms of the task description, the environment, what are the shift times, the rotation, the activity level that they have to do, the physical demands of the day, and a general description and comments and the overall physical demand of this to be done as well, so that not only has the employee knows what they've got to do, the work force, the GP, any insurer will actually have an understanding of what is required within the organisation and every task that is operational at this site. So what's in a task-specific pre-employment assessment? It's just like a health screening, not just like, can you bend down, touch your toes and things like that, but also just doing a very brief medical screening of what their blood pressure, heart rate and things are, but also some special tests. So, it might be that they might have to do a lot of gripping or lifting. So what's their shoulder strength like? And, there's some parameters that we can actually test to see if you've got an increased risk of shoulder injuries with certain aspects of employment as well, such as have they got some neural tightness, such as carpal tunnel syndrome or symptoms before they start their work within the organisation. What their grip strength is, so they might have to really do quite a lot of grip strength and strong grip strength, but if they don't have it, then they don't really have the physical capabilities for that work. If they can't lift what they need to lift, then again, they haven't got the physical capabilities to perform that duty. But what we can do is then give them a strengthening program to actually bring them up so that they can be able to perform the duties that's required. And put them into different perspectives. So it might be leaning forwards or reaching overhead or squatting or kneeling, and making sure that they can actually perform those duties before they're actually employed. And some of the legal implications for this is that sometimes people or employers want us to actually say, oh, should I employ the employee? So all we can comment on from a legal point of view is if the employee meets the physical requirements of the job that you've provided us to test them for. So we shouldn't really comment on should you employ them or not. All it is do they fit the physical requirements or not. And what we can do is provide parameters of employment recommendations if there's any shortfall. So if someone can't lift 30 kilos, but there's other jobs within, say, your organisation that only require 15 kilos and that's all they can lift, then they're the jobs that this is probably better for. So again, we're reducing the risk of further injury or injury to a new employee because they haven't got the physical requirements for them to do that job. If there's no task-specific assessment, then it may not stand up in court. So if it's just like can you bend down, touch your toes, from a pre-assessment or a pre-employment assessment, does that really test if they've got the physical capabilities to do the work that you're saying? The pre-employment should be used to appropriately place the employee into positions, not whether you should employ them or not. So it really positions them to where their physical capability at that time can dictate to where they should go within, say, a factory, an organisation, or even an area within, say, a manufacturing process line. It should be performed safely at all times, and it should be quite objective and not subjective as well. I think what's the positives for this factory and insurance companies that now we've got a job library for each position within the factory. Each position has the postures, loads, actions, and environment. Task analysis can be used by anyone within the GP or the independent medical assessor. The company can now test each new employee that if they have the physical capability to perform the job requirements that they've set. And the company can really offer prospective employees a rehab plan to get them to the ability to perform the task. So we pick that up early rather than later, and allocate staff to the appropriate duties early in their employment. So it's not, again, once they injure themselves. And this really alerts the company to any high-risk jobs that they need to assess further. And this is where your risk assessment can continuously happen and involve the employees, and any task rotation requirements are identified as well. The manual handling training, and is it really worthwhile? I think it depends on what studies you read. Low weight manual handling training and activities probably doesn't do a lot, but when you get to the higher stuff, most of these studies are done on manual handling that are below 10 or 15 kilos, but a lot of industry is above that. So it depends on the teaching style, so there's no consistencies. So I always say it's got to be task specific. There's no use me just saying, going through a PowerPoint and going, you've got to lift this way, you've got to do it that way. They've actually got to feel it. They've actually got to see it. They've actually got to then do it on the job as well. So what I always say, if you're going to do some type of manual handling training, you can do a bit of theory, but then you've got to do a practical component and actually get them doing what they're going to be doing in their workplace as well. So it's got to be task specific as well. And this may include doing a bit of a risk assessment on some of the tasks that you're going to be doing as well. Some of the pause exercises, there's big on pre-warm-ups and things like that. What I usually say, it should be a pause exercise, so people should do it constantly during their employment. So if you're sitting for a period of time or standing, you need to do it there. If you're doing a lot of lifting, you need to do it in between doing your lifting or loading and things as well. So this is some of something that I've produced where there's some different exercises for some organisations. Say this is good for people who are on computers all the time, so that we can actually unload some of the areas that they are actually experiencing. But it's got to be specific to the area. If you have a look at some of the postures, this is just a good diagram of trying to get your angles all right, so an arm's width away from your screen, 90 degrees, elbow bend. You should have your feet supported. You should have your back supported as well. And it depends on if you need armrests as a personal preference. But the top of the screen should be about eye level, and you should be comfortable. The shoulders should be comfortable, not leaning across the desk. Same as if you're standing. The same principles as sitting. You should change your position every 45 and 60 minutes if you've got a standing desk. You shouldn't stand all day, you shouldn't sit all day. So the recommendations is just trying to change that. And you should have that head balanced over the centre of gravity, so not leaning forwards, not leaning back. So again, the same principles as sitting, but just in that standing position. And the last thing I just wanted to look out for is just your COVID, so your long COVID. And if you really think about long COVID, not just from a sporting or, oh, you've had some COVID, okay, you're still feeling a bit fatigued. What impact does that have on to the employee when they come back to work as well? So, do they still have sleep disturbance or fatigue? Do they still have difficult focusing, increased anxiety, other neurological symptoms such as tingling, pins and needles, aching in the legs or in the arms, a low mood, memory problems? So you can see those types of things, if they're coming back into a high risk area and they have some memory problems, they might not actually remember some of the finer aspects of their role, even though they've been there for a while. Their mood's low, they might be really fatigued because of sleep. But the fatigue aspect of long COVID can be an issue for longer shifts, say 12-hour shifts or night shift or going in between night and days in shift work. So they're the aspects that I think as an organisation you need to be aware of. And if you look at returning back to sport, we can use it very similar to returning back to any type of physical activity, such as tradies or even sitting for most of the day. What we try and say, they've got to have minimal or no symptoms before they return back to any type of light exercise. Because if you do come back to a physical work and you still got some shortness of breath, you've still got some fatigue and things like that, you have got a possibility of actually having some long COVID symptoms, which can go on for years. So you've just got to be really aware when they come back to work that the long COVID and their COVID symptoms have settled right down. So I usually just say, stop, don't push your limits, try not to overexert, rest as much as you need to. And it's not just sleep, but it's also having some rest periods during the day post-COVID, and pace your physical activity and cognitive activities as well. That's my contact details. If you've got any questions or want to know any more information, I'm on Twitter, on LinkedIn, and my email address as well. So I'm happy, Lauren, to take any questions for the last 5 or 10 minutes.